When you need healthcare, it can be pretty stressful, right? You're focused on getting better, but then there's all the other stuff, appointments, maybe places you don't know, and just the paperwork.
Definitely. And you might hear about things like hospital quality standards or rankings.
Yeah.
Sort of big picture stuff.
Yeah, exactly. But how does that, system level quality talk actually connect to your experience when you need care?
That's the connection we really dug into for this deep dive. We looked at sources covering the big accreditation bodies, that Joint Commission International, or JCI, and India's NABH.
Okay, the one setting the standards.
Right. And also the consultancies, like one called Supremedic, that actually help hospitals, meet those standards.
And then kind of surprisingly, how all this ties back to something really basic you probably have in your wallet, your health insurance card.
It seems small, but it's a key piece. So today, our mission is basically to unpack all this. We want to show how these complex quality standards that help hospitals get to achieve them, and your own readiness to actually access care, how it's all linked.
And why understanding a bit about these standards actually matters to you, and why just having that little card handy is maybe more crucial than you think for getting good, efficient care.
Okay, let's unpack this. Where should we kick off? Maybe with the foundation.
Yeah, let's start there. How do hospitals signal quality? Accreditation seems to be the main way, based on our sources.
Exactly. It's like a seal of approval showing they meet certain benchmarks. And the sources really zeroed in on two big players, JCI for the global scene and NABH specifically for India.
JCI, that's the international one. Heard of them?
Yeah, they're a huge deal globally.
Mm-hmm.
Our sources call them a leader in healthcare quality, patient safety. They operate in over 70 countries. Yeah, their mission statement is all about enabling and affirming the highest standards for everyone. Been doing it over 20 years, accredited thousands of programs, loads of experts involved.
So they really set the international benchmark.
Pretty much. They create these really rigorous standards, and they even have specific international patient safety goals.
Targeting specific problem areas.
Exactly. Things that commonly go wrong. Their whole vision is aiming for, zero harm and really reliable care. Lofty goals.
Okay, and NABH, same idea, but focused on India.
That's the gist. It's part of the Quality Council of India, set up specifically for accrediting healthcare organizations in India, tailored benchmarks for the Indian context, meeting local needs.
Okay, so a hospital gets accredited. What does that actually mean for them and, more importantly, for me as a patient?
Good question. The sources point to a few things. For the hospitals, sure, it's a competitive thing, helps with risk management. But for patients, and this came up again and again, it builds confidence.
Confidence in the quality and safety.
Yeah, confidence that the place is serious about safe care. It also helps the hospital itself, organize its safety efforts better, creates a whole culture around patient safety, ideally.
So it pushes them internally.
Right. One source even quoted a hospital president saying the JCI process was great training, really boosted teamwork and communication.
Huh. So these standards, even though they're complex and behind the scenes, are really designed to improve my actual care.
That's the goal.
Yeah.
But yeah, achieving those standards, it sounds like a massive undertaking for a hospital.
It really does. Which, I guess, leads us to the next piece. How do they do it? Our sources highlighted organizations like Supremedic Consultancy. They seem to act as, partners for hospitals.
Partners, yeah, helping them navigate the whole process.
Exactly. From the ground up, actually. The sources mentioned they help with planning, designing the hospital, managing operations, and crucially, getting those quality systems in place for accreditation, like NABH.
So they provide the how-to. Implementing the practices needed to hit those benchmarks we talked about.
Precisely. And it's not just for the giant hospitals, apparently. No, sources said they work with all sizes, nursing homes, multi-specialty places, even diagnostic centers. They bring business expertise, finance, marketing. But the key thing seems to be helping structure standard operating procedures. SOPs.
Right, the SOPs,
Yeah.
Those super detailed step-by-step instructions for everything.
Yeah, how to do specific tasks safely, consistently, administering meds, handling equipment, you name it. Those are like the building blocks for meeting accreditation.
Okay, so you need the standards from JCI or NABH, and then maybe help from a consultancy to actually build the systems and procedures to meet them. Make sense?
So that's the hospital side, the system building. But let's bring it back to the individual. What about you when you need care?
Right.
How do you plug into this quality system?
That's where it gets really personal, doesn't it? Because all that complexity,
Yeah.
your main interaction often comes down to something incredibly simple.
The health insurance card.
Yep. that little piece of plastic, or maybe the digital version now. Sources called it a medical passport, a financial shield. Kind of dramatic, but...
But it highlights its importance, right? Especially for accessing cashless treatment.
Oh, absolutely. Cashless is huge.
Yeah.
You show that card at a network hospital, and bam, they can start the process, so you hopefully don't have to pay a massive bill up front for covered stuff.
Which, in an emergency, lifesaver.
Total game changer. And it's not just about the money up front. It speeds things up, too.
How so?
Well, it's instant proof you're covered. The sources say it makes verifying your eligibility way faster, cuts down delays, whether it's an emergency or just a checkup.
Okay, so quicker verification, and it has all the key info right there.
Exactly. Your name, policy number, who the insurer is, their contact info, often a helpline number, and, importantly, the expiry date and maybe details for the TPA.
The TPA, the third-party administrator, the ones who actually process the claim.
Right. Having their info handy helps the hospital know exactly who to contact to get the approvals moving. It just streamlines everything.
Okay, so this card is pretty critical. But it's easy to forget it, isn't it? Especially when you're stressed or unwell.
It really is, which is why the source has had some super practical tips, basically the do's and don'ts for making sure it's there when you need it.
All right, let's hear them. The main do.
Keep the physical card in your wallet or purse. Simple, old school, but effective.
Can't argue with that.
All
But
right.
we live online now.
Yep, so the next big do is have a digital copy. Get the e-card from your insurer, if they offer one, or just take clear photos of both sides. Save it somewhere easy to find on your phone. Cloud drive, maybe?
Smart, like a backup plan.
Totally. And another crucial do, especially for families, share it. Make sure your spouse, maybe older parents, anyone you care for, knows where the card is, or, better yet, has that digital copy too.
Good point. Especially if someone else might need to handle things in an emergency.
Exactly. And finally, keep it updated. Policies change, you move, you get a new phone number. Make sure the info connected to your card is current. Otherwise, delays.
Okay, those are the do's. What about the don'ts? What common mistakes mess things up?
Well, the obvious flip side. Don't forget to carry some version of it, physical or digital, especially heading to a hospital or clinic. And definitely don't lose the physical card without having that backup.
The digital copy saves the day again.
Pretty much. And the other big don't is simply not sharing the info with family. Seems obvious, but in a crisis, having someone else able to pull up that policy number can be invaluable.
Okay, but what if the worst happens? You're in an emergency, it's total panic, and you realize you don't have the card, physical or digital. Are you just stuck paying up front?
Not necessarily. The sources suggest a few things. First, if possible, get someone at home to send you a photo of the card.
Right.
Or call the insurance company or the TPA directly. They all have helplines. You can find the number online usually. Explain the situation.
Okay, talk to them directly.
Yeah. Also, tell the hospital staff early that you are insured, even without the card right that second. And critically, keep everything. Every bill, every discharge summary, every prescription. You'll need all that paperwork if you have to file for reimbursement later.
Got it. Keep the paper trail. So let's tie this all together then. We've journeyed from these big international quality standards set by bodies like JCI
And national ones like NABH.
through how consultancies help hospitals actually implement those complex standards.
Right, building the systems, the SOPs.
And landed on this very simple personal item, your health insurance card.
Yeah. And connecting those dots, it really shows something interesting, I think. You have this whole complex system designed for quality and safety standards, procedures, checks.
A whole infrastructure.
Exactly. But your smooth access into that system, especially getting things like cashless service, often hinges on that one little card. It's kind of the key that unlocks the door to all that background work.
It's a really powerful link, isn't it, between the huge effort hospitals and these bodies put into quality and your own sort of personal readiness as a patient. Having that card is part of making the system work for you.
It really highlights how your preparation complements the system's preparation.
Yeah.
So thinking about all this, the layers involved, it does make you wonder, doesn't it, what other seemingly small everyday actions we take might actually have a pretty big impact on how well we navigate other complex systems in our lives. Something to think about.